Welcome back to Unit 2. This is our second lecture in this unit, focusing on leadership for value-based care. As you review this lecture, you might want to keep in mind its optional activity. At the conclusion of the assessment for this unit, you will have the opportunity, if you so choose, to participate with your fellow MOOC mates in a discussion of the extent your organization is participating in value-based care and to compare notes on who is taking the leadership role for this. As we noted in the last lecture, you should now feel comfortable with the concepts of volume versus value, medical versus health, and have a good appreciation for the alternative payment models and the degree to which they shift risk to providers. Please note that the optional activity pertains to anyone working in a provider setting, health plan, or vendor supplier of health services. Obviously, unless the provider is a provider-sponsored health plan, which few are, the provider must engage with various health plans, including Medicare, Medicaid, potentially other federal plans, commercial plans, blue plans, etc. Each plan with which a provider engages may have one or more different value-based care offerings. If you work in a health plan, you may also have different offerings based on the level of risk your providers are willing to assume. If you work for a vendor supplier, such as an EHR vendor, contracted coding company, analytics consultant, health information exchange organization, healthcare clearinghouse, or any number of others, consider your customers and the overall degree of value-based in which they are involved. Sometimes vendor suppliers have actually a better handle on what their customers are doing than the customers themselves. We looked at this slide at the end of the first lecture in this unit, Leadership Tops List in Transitioning to Value-Based Care. We observed there is much to do for long-term success in value-based care and many challenges along the way as we make the transition. Of primary importance is ensuring leadership for value-based care. And since the business, quote unquote, of healthcare is clinical leadership is essential. But much as healthcare organizations have been siloed in the past, so too has clinical leadership been highly focused. Both hospitals and group practices have executive leadership as the primary decision maker for all aspects of operations in the hospital or practice. Clinical leadership has been focused on the respective clinical silos, either in a hospital or practice. A pathologist directing the lab, a radiologist over the radiology department, etc. In addition, there typically is a chief medical officer who again views his or her responsibilities narrowly, focusing on carrying out the responsibilities of the medical staff bylaws, especially related to quality of care. Now, this is not to suggest that such is not important, but should not be the only focus. In many hospitals and even in group practices, there is typically an adversarial relationship between the chief executive officer and the chief medical officer. Transitioning to value-based care then, with value being quality and cost, requires the convergence of financial administrative operations with clinical processes. It cannot be overemphasized that lowering cost will not occur without quality improvements, and quality improvements are just as important. Many clinicians in the past have expressed concern about various quality improvement initiatives in which the focus has been on standardization, speeding up processes, reducing waste, etc., etc. In healthcare, best practices are certainly very important, but treating every human being that clearly is unique in a standard way will not achieve desired outcomes either. healing also takes time. Even as we find that getting patients out of beds helps quicken the healing process, such findings occur as a result of considered research, not stopwatches. Similarly, medically unnecessary procedures could be considered waste that can and should be reduced, but medical necessity requires an unbiased clinical determination. So this second lecture in Unit 2 is going to look at some of the ways clinical leadership can be enhanced with a broad focus that will ensure the win-win for all stakeholders needed for success in value-based care. What is leadership? Perhaps we should first distinguish a leader from leadership. In addition to a leader being given a title to a person, and leadership being a skill or competency held by a person, it must be observed that not all persons with the title of leader have leadership skills, and there are persons without the title of leader who have leadership skills and may exercise those skills as informal leaders. In this lecture, we're going to focus on leadership traits leaders need for value-based care and how to cultivate those traits. There are probably more ways to define leadership than there are leaders. We're going to explore some of the definitions offered by nationally recognized leaders. But we must recognize that leadership is hard. We are not born leaders. We need to learn how to lead. Many leaders are designated officially or by default, but have no training in leadership and often are poor leaders. Whereas those who seek leadership training probably have something that innately means they have the potential for becoming an effective leader. An effective leader is one who gets others to join in an endeavor to achieve a goal. Now let's look at some leadership definitions. What is it? What is it not? Some of the most respected leaders in our nation's history have expressed definitions of leadership, as I mentioned in the last slide. Warren Bennis said, "Leaders are people who do the right thing. Managers are people who do things right." And I've added to that, managers are people who do the right things right. Dwight Eisenhower is quoted as saying, "Leadership is the art of getting someone to do something you want done because she wants to do it." Peter Drucker, the only definition of a leader is someone who has followers. Bill Gates noted, "As we look ahead into the next century, leaders will be those who empower others." Some of these definitions seem simple, others profound, some on target, and some perhaps lacking in certain respects. Still, the essence of leadership comes across in these quotes. A person with leadership skills enables them to pursue a cause, be an explorer, develop a company to beat the competition, win a battle, or even attempt to annihilate a people. And with that last point in mind, it is important to think about what leadership is not. Leadership has nothing to do with seniority or one's position in the hierarchy of a company. One would hope that age brings wisdom and tenure the ability to observe what works and what doesn't, but even that is not always the case. This is especially true for persons with leader titles who have led through dictatorship, intimidation, bullying, or other nefarious means. Leadership has nothing to do with titles. Not all members of the C-suite, the chief executive officer, the chief financial officer, the chief information officer, etc., they don't all have leadership abilities, but they hold the position because they are best at what they do. The old Peter principle of promoting to the level of one's incompetence. Just as leadership needs to be developed, so too must recruiters' abilities need to be developed to identify leadership skills in those they are pursuing to hire or to promote. Leadership has nothing to do with personal attributes. A person can be kind and gentle and friendly and outgoing, but with all positive traits, these are not necessarily those of leadership. Leadership often implies but does not necessarily result in good. Sadly, there are some in this world who have or who can truly rally for a cause and engage others to follow very effectively, but their goal from the outset was or is evil. Leadership is not management. Organizations need both effective leaders and managers. Ben has probably stated this best in his quote mentioned above. Leaders are people who do the right thing. Managers are people who do the right things right. Essentially, an individual with leadership abilities creates an inspiring vision of the future, motivates and inspires people to engage with that vision, and manages delivery of the vision. We must remember, however, that there are persons with these leadership abilities who have led for good and led for bad. And of course, we want success for value-based care.